My name's Jessica and I'm a second-year doctoral student studying nursing practice. In today's video, we're going to be talking about how to pass NCLEX. I have a 5-step process to passing NCLEX. Number 1 is to identify the resources that you're going to use to study. So I recommend having some sort of study guide and then also having practice questions. Now, the thing that's important about this is you want a study guide that is condensed, that is going to go over all the concepts that you need to know to be able to answer questions on NCLEX. And the second part is to have a database of questions that have really, really good rationales so you can understand where you're going wrong and navigating answers in the questions that you get wrong. For the study guide, I think it's important to have something that is condensed, using something like the Saunders book or some of the NCLEX guides that you buy in the store. I found for me were just way too long. I don't want to sit there and read 500 pages of information and hope that I can remember it all. The other thing a lot of people do is they attend like NCLEX reviews. I did not do that. I know for me, I will tune out after about 4 hours of content. I've learned that's my learning max, to be taking in information verbally. Sit in a lecture hall or a classroom and listen to somebody speak for 8 hours a day for 6 days straight. I can't do that. So that was not an option for me. If that's something that works for you, you could probably use that in place of a good NCLEX study guide. I do have an NCLEX study guide. I'll put the link below, which you're welcome to use if you want to use that for your studying, or if you find something else or you've created your own, you can use that as well. So I would recommend that you create your study plan. And to do this, you're using the 2 resources that you chose. So your study guide and your question bank, and you're going to come up with a plan. So I recommend a month and a half. That's what I used to study. I took the first week and the last week before taking my NCLEX and reviewed the study guide. And that way I can go over all of the concept learned in nursing school and kind of refresh my brain from things that I had maybe learned 2 years ago. Like, that's a really long time to remember content. So, and then for the month between those 2 weeks, I did the question banks. I recommend doing 75 questions every single day. And that way, by the time you take NCLEX, you're so used to just busting out 75 questions. It's a lot of questions, especially when they're nursing questions, which are really tricky. To kind of get your mind used to answering 75 is really good for when you go into the NCLEX. Personally, UWorld, that's what I used, and I thought they were great. Their rationales are very in-depth. They have pictures, and they really, really teach you the information that you need to know to answer the questions. So I thought that that was a great resource. So step 3 is to not do anything the day before NCLEX. Block it out. Don't put on your study plan and just take the day to relax. When I tell you that your anxiety is going to be through the roof, it is true. And the last thing you want to do is be flipping through pages, being like, oh, I don't remember this. Your mind in that space before taking NCLEX. You want to be in a space, okay, I've done what I can do to prepare for this exam. I need to stay calm. I've got this. I've been working towards this. Also put in your mindset that the day of the exam, you're going to be taking the maximum amount of questions. Yes. So on the day of the exam, you can have between 75 and 265 questions, and you have 6 hours to complete them. So you don't really know what you're gonna get. And if you guys don't know how NCLEX works, check out my other video. I'll put a link above which explains NCLEX, because it's a computer adaptive exam, so it's different for everyone and it'll go in depth. Day of the exam, expect to go in there and take 265 questions, and if it turns off before that, it's most likely a gift from God. The last step, step 5, is to know how the NCLEX works. So like I said, there will be a video linked above to that video, which goes over exactly how NCLEX works. And it's important to know that, because when you're taking the exam, halfway through, the questions started getting extremely difficult. And I could feel my brain panicking. I could feel it panicking, but then I knew how NCLEX worked. So I could remind myself that these questions are hard, not because you don't know your stuff, it's because you've gotten so many right. So keep going. And doing that really tuned down my anxiety and allowed me to think through the questions, and my test turned off at 75. And then you sit there for a couple days and you're stressing, did you pass? But if you know how the exam works, you can kind of guess when it turns off if you passed or not. So if you guys want to learn how NCLEX works, definitely check out that video. I will link it above. And also check out my NCLEX resources. I really want to help you guys pass. So hopefully you like them. And yes, that's how you pass NCLEX. So hope you guys enjoyed this video. Make sure to give it a thumbs up and subscribe down below, and I'll see you guys soon.